Dr. Garrett Harper and Dr. Bob Graper. So we were actually just kind of talking about how this all started and how we got to doing Facebook Live. Certainly COVID had some of that, but tell them a little bit about what we used to do.
Well, when I was training in Dallas a long time ago, they did a couple of seminars trying to educate patients on cosmetic surgery. And when I moved to Charlotte, we were the first ones to ever do that. And we used to do them every other month. And we'd move all of our furniture out of our reception area and move in chairs. And we'd hung a screen right up here. And we had a double slide projector that would, change 2 slides at a time. And they were those old squares of slides. And then we moved to computer digital images. That was a big advance. And we did that for a long time.
Right.
And then COVID came and it forced us out of getting people in the office. And, technology is a good thing.
Sure.
And now we reach many more people, much more convenient for them. And the information is all the same.
Right. When I started here maybe 7 or 8 years ago, and we used to literally, this room used to be filled up with patients, potential patients that wanted to bring their questions. And then we'd run into a night where inevitably it would be raining or there'd be some storm or bad weather or something. And so we just kind of felt like the best way to reach our audience and be the most convenient was to do a Facebook Live seminar, and they've worked out fantastic. Now you have the ability to ask questions. I will be looking down at my phone from time to time, and I will kind of ask Dr. Graper some questions. I'll try and answer some as well, but we're briefly going to talk about basically all the different elements of our practice, and then we'll go into specific before and afters to discuss, surgery. Not much has changed in the last 6 months as far as like technology from a surgical standpoint that I have to share. We'll certainly go over things in case patients haven't ever watched one of these or still wants to familiarize themselves with some of our surgeries. But let's talk a little bit about the practice. Obviously, I have 2 surgeons, but tell them what other departments we have here as well.
Well, we have a skincare department that does different kinds of lasers, hair removal lasers. We do intense pulse light, IPL, otherwise, or also known as BBL, that removes brown spots, removes red spots. It does treats photo aging. They do light chemical peels. They recommend daily skincare that is very helpful. You can think of that daily skincare as like working out every day, and a deeper chemical peel or a deeper laser treatment would be like running a marathon or some major sporting event.
Right.
That's one department.
Sure. So talk to them a little bit about the RF microneedling. So we bought that a couple of years ago. We did a lot of research into it and felt like we got the best machine for our practice because our estheticians are the ones that do the majority of that. But we've moved with RF microneedling, which is, standard microneedling did a great job of stimulating collagen production. And it's almost like, I tell people, it's like aerating your lawn, right? It's like poking little holes and causing little micro injuries to your skin that then fill up with collagen, which can strengthen, can plump up the skin, make it look more youthful and do those things. And then they went a whole nother kind of evolution with it to where they now have an energy delivery system with it with radio frequency that will actually get into the deeper layer of the skin, the dermis. And not only does it poke these little holes in there that stimulates this micro energy and collagen production, but it'll also deliver energy, which causes it to shrink up and to tighten. So that's another avenue that we've got. And then adding one step further to that, we've actually kind of started doing PRP associated with our RF microneedling. So what is PRP for the folks at home that don't know what it is?
Well, it's platelet-rich plasma, which is, I think, an easy way to think about it as a growth factor that will further stimulate the collagen because it'll seep down into those puncture wounds that the RF microneedling does,
right,
further energizing the skin. Now, Dr. Harper said that we're not doing really anything new in the last 6 months.
Right.
This is not a new technology. It's new to us. And when you said that, I thought, well, we may not be doing anything new, but everything we do works.
Absolutely.
And we may not do everything,
right,
but what we do absolutely works. And this works It's not a facelift. We kind of thought maybe it might be a bigger step toward a facelift,
Sure.
but it does great things with the texture of skin, and it will tighten the skin a little bit. And we're going to tell you if you're a good candidate or not a good
Right.
candidate. But it's a nice tool. It's not,
Right.
it's not the equivalent of facelift though. And so we'll make sure you understand everything and all the options there are.
Right. A lot of patients don't want the downtime, or they need a bridge before they kind of consider neck lift, facelift. But the entire body can get RF microneedled.
Right.
It used to be one of these things that we did the lower face and the neck, and we saw good tightness and good firmness, and that's kind of where everybody was focusing their attention. And now we've got larger headpieces on this machine that allows us to
You've
do.
done it on tummies and knees and legs, and
we do it all the time back in the operating room. We also have a good system to help patients. They put a topical numbing solution on for a little while, and then we're able to do this injection kind of pattern on patients that allows them to be numb, because this thing delivers some energy. And if you're really going to dial this up and get the result, the best result for you, you got to dial it up. You can't kind of just go into it half-witted. So it's important that the patient's comfortable. And of course, that's one of our main issues here. We've got a couple of questions. Wow, this is great. All right. First question, is it safe to do Botox and fillers while breastfeeding?
From a medical standpoint, I think most people would say, why take a risk with anything while you got anything to do with pregnancy? From a medical standpoint, I'm a plastic surgeon. I'm not a medical doctor or a GYN. I probably would say yes, but I think most people default to, we're not going to take any chances with your baby.
Right.
And so probably would say no.
Right. Everything, people ask about that, I don't know about putting Botox, botulinum toxin in my body. And I'm like, it's not going in your body. It stays where it's injected. Right. And so the same with filler also, but it is one of these things where, if people would tell you not to go lay down and get massages during your pregnancy. So it's probably easier and safer and smarter, because if God forbid something did happen.
Yeah, it's a liability. It's a lawyer's world.
Yeah, you'd be kicking yourself.
I'd be surprised if there was a problem, but
right.
Take a chance.
Right. So another question is about tummy tuck. And can you give us the skinny on what to expect? That's kind of funny. It's pretty good. Good pun, as I'm sure it was intended. So a tummy tuck, in my mind, is an abdominal procedure that combines bringing the central abdominal muscles back together. Our muscles go from top of our rib cage to our pubic bone, and then they're to meet in the middle. And if they don't meet in the middle, then you can have kind of a more rounded shape. And it's typically either post-pregnancy, or if somebody has a lot of intra-abdominal fat, they can get more of a rounded shape to the abdomen. If it's not a lot of intra-abdominal fat, then you're probably a great candidate to have your muscles brought back together. And that's just a plication, like a corset stitch that zips straight down the middle of your abdomen. And then that sets kind of the foundation for which the skin and remaining fat to the abdomen. Everybody needs skin, fat, and muscle. You never want to be without any of those, or it will be a disaster. But that then gets kind of laid out, repositioned on the abdominal wall, and the excess is cut off. From a what to expect afterwards, I believe in drains. I use drains. Dr. Graper uses drains. I think he takes his out a little sooner. He has a little different method of how he closes the abdomen. Both are great. I do not think that drains get in the way of your social life. After a tummy tuck for the first couple of weeks, you're not wanting to do too much. No. Anyways, you are bent over using a walker for the first week. We want you at 90 degrees so that your blood vessels are as large of diameter and bore as possible, so that we can get good oxygenated blood all the way throughout your tissues. We'll have dressings over your incisions. You can shower in 2 days. You're not doing anything that gets your blood pressure or heart rate up too much. Drains are out typically at 1 week or 2 weeks, maybe 5 days for Dr. Graper's patients. And then you can slowly start to stand upright. By 2 weeks, you typically feel a whole lot better. My patients at that first week zone are like, wow, that was kind of rough. I certainly felt it. A lot of times they're complaining most of staying bent over. That's something you take for granted.
Would you say C-section-esque type recovery?
So it depends, right? I mean, C-sections are emergency surgeries. They're done very quickly. It can be a muscle splitting procedure. And this is not that muscle splitting. I mean, it's certainly tight. I tell patients you're going to feel like you just did the most intense core ab workout that you've done. And that stays with you for several weeks. It lessens as you kind of get further away from the surgical time. But, patients at 2 weeks, are standing upright. Their drains are totally out. They've got their binder on. They still have swelling, which they'll have for several months.
And also, you're using Exparel.
Correct. So what is Exparel for patients that don't know?
Exparel is a long-acting pain medication we inject into the muscles. And really what we're trying to do is inject it right around the appropriate nerves, and it numbs up the whole area so that the discomfort should be much better. I won't say it's nothing, but it's much better.
Yeah.
And it lasts 3 or 4 days. It's really fascinating technology where they put Marcaine, which is a long-acting 3 or 4 hour anesthetic, and they enclose it in bubbles of fat that dissolve over a couple of days. And why they don't all dissolve right away, I don't know.
Yeah, it's like a time release.
Yes.
It's great.
And then over time, they release this Marcaine and you stay comfortable for 3 or 4 days. So the procedure, tummy tucks are probably more tender than dermal lipectomies,
Sure.
which is a tummy tuck without the muscle repair.
Right.
But we offer it to everybody, and virtually everyone uses the Exparel because it helps so much.
Right. As a follow-up question, somebody asked about how to sleep after a tummy tuck, and can you sleep on your side? And that's the opposite of what you want to do. For my patients, I feel like you can't really sleep on your side without twisting. It's hard to do that way. So I have my patients sleep in a reclined position. And I mean, if you mimicked yourself with a good kind of 90-degree bend at the waist with feet on the ground, this is a great position post tummy tuck. So if I'm going to lean back so I can go to sleep, you just want to have a bunch of pillows behind your back, and you want to have some pillows behind your knees. But I would not roll over on my side. Twisting stuff are not the movements that I want. You want the skin and the subcutaneous fat to then adhere back down to the muscle. So anytime we're twisting our torso or doing any of those things, we've got shear forces that don't allow those little micro attachments to gain strength to really kind of close off that space. There's another question about sunspots. And the question was, is dermabrasion or chemical peels better for sunspots? What do you think?
Well, I would take the easiest thing to do first, which is just creams.
Sure.
Hydroquinone works well. If you combine it with Retin-A, the Retin-A makes the cells turn over faster. And if they're turning over faster and the new cells are not, don't have as much pigment in them because of the bleaching cream, then the new cells are lighter and lighter and lighter. And that works over 3 or 4 months.
Sure.
If you need something much faster, then this IPL, the light therapy, it's like a laser, but it's not a laser. The only thing that's similar is that it's using light therapy. And that can make a brown spot go away in 2 or 3 days if it is a superficial brown spot.
Right.
If it's a deep brown spot, it really won't work at all, and you've got to go with the creams.
Right.
The chemical peels, the deeper ones, these chemical peels are a very generic term. It could be very superficial. It could be very deep. Dermabrasion, chemical peels, they do the same thing if taken to the same depth.
Right.
We don't use the old-fashioned dermabrasion where you're basically sanding.
Right. It's like sandpaper.
Yeah,
That's
and
exactly
it's on a
right.
flywheel. So we use chemical peels, and we like chemical peels because we know how to do them, and we don't have to charge for a $200,000 laser that uses light energy to do the exact same thing. So the cost can be less,
Right.
and the result is the same.
Absolutely. So another question is about flabby skin on the back of the arms. And so obviously there's a spectrum of this, right? I mean, there's a little bit of looseness that everybody has. The medial skin, that's up against your body is the thinnest skin on the body. And so if you have kind of a flabby waddle, you've got to figure out, is it just loose skin? Is it loose skin along with fat? Is the fat what's really kind of causing this unwanted appearance or unwanted flabby motion for you? So you got to address both those things, right? If you have an abundance of fat, you need the fat removed. Liposuction is a fantastic way to do that. And on milder cases of patients that have good skin quality, that may be all you need to improve the contour of your flabby back of the arm skin. If you need a boost, right, you can do some either removal of fat through liposuctioning along with the RF microneedling. I mean, the Morpheus has been great at really shrinking up that skin, tightening that skin with or without liposuction. If you grab back there and it's just skin and there's not fat that you can feel within those tissues, then you probably don't need the fat removed and you would just need RF microneedling. Now, I do a lot of massive weight loss surgery. So in those patients that have really stretched out their skin, a lot of times they need the skin excised, right? And that's a brachioplasty is what that term is called. And I mean, that's an incision. We never go beyond the elbow, but I mean, it's an incision that we keep to where when your arm is close to your side, it's hidden. There's all different permutations and incisions people have chosen, but I think that that's the one that looks the best, heals the best, is the most hidden. But I mean, you're left with an incision that you can see. So when people that don't have flabby arms see that incision, they get turned off by it because they don't realize that it's what you're trading for that excess skin, right? If you have poor quality skin and a lot of fat and it's really flabby and we liposuction the heck out of that area and remove the fat, then that skin can become flabbier, softer, even more redundant. And so that's when you need to excise it.
Yeah, different, but not better. And
right.
The other incision is on the back surface of the arm.
Right.
And, Garrett uses that sometimes. We use both of them. And you pick your poison.
That's right.
But that's what cosmetic surgery is, the surgery has great advantages and it has some downsides.
Right.
And when the advantages are huge and the downsides are minimal, it's a great thing to do.
Right.
And that's what we help guide you into because we know where you're going.
Right.
And, if it's a great thing, we're going to encourage you. If it's not a great thing, we're going to discourage you.
Well, and it's hard, right? Because we're surgeons and we know that in this line of work, our patients want to have the most beautiful results, right? And you typically don't correlate beauty with scars, but people need to understand that if you're coming to see a surgeon and we're going to make an incision on you, the human body heals by scarring. Now, our job is to try and make the scars as beautiful as possible, right? So we try to make the best decisions on tension, on how to close it. We do our best job kind of putting every location, which is probably the most critical of all. But ultimately, for scarring for most patients, the majority of it's going to be your mom and dad and like how your genetics are. I always kind of quote to people, your scars, I'd love to take credit for the beautiful ones, like I have some magic stitch, but I don't. But it's going to be 90% your genetics, 5% how great of a job we do, which we promise to do our best, and 5% your aftercare, which are things, again, like surgical tape, scar gels, silicone sheeting, microneedling, laser therapy, PRP. All of those things are modalities that you kind of go up the ladder in complexity for trying to get you the prettiest scars possible. So another question, how long does it take? How long does fat grafting to the buttocks typically take to show? Another question was about fat grafting and whether or not we fat graft to the breasts. 100%. You are limited with the amount that you can fat graft to the breasts. You have to layer the fat in kind of evenly throughout the breast. You can't just put a big blob of fat inside the breast, or the central part of that will not survive and will become very hard and can become painful. So there's a limit to how much you can put within the breast, right? From a fat grafting to the buttocks standpoint, this is kind of a point of contention of mine a little bit, because I feel like people get misled through social media, through marketing on the results, right? I mean, the before picture on everybody is this person with their back extended and their buttocks clenched, and they typically have kind of the muffin top area, and then the after picture is always on the table, right? Looking down from the butt that's like, been bent up and put in the face of the camera, and it just looks so much nicer and better shaped. And then looking down the OR bed, it gets narrower as you get, and it's just camera tricks. Liposuction and fat grafting is not a large volume answer, long-term answer for a better figure, in my mind. I tell people, you think of the story of the three little pigs, right? And like which pigs kind of raced to do something quickly and build their house out of a product that really wasn't going to last and do any well. I mean, the buttocks is made up of three major muscles, right? And so you got to work out all three of those muscles. You can't just do air squats and think that you're going to get the shape that you want, but you need to understand that your body has limitations and that a lot of problems can occur later on down the road if we just willy-nilly liposuction as much from your body and throw it all in your rear end. I think that's a bad idea.
I have zero experience, but from an educational common sense and surgical common sense, I think in 5 years or 10 years, who knows what those people are going to look like.
Well,
for the 600 cc fat.
I think we're starting to see, and I think we're starting to see that as people do more fat grafting to areas that as their weight and their skin quality changes with aging, as it does, that great initial result where the buttocks was tense and inflamed and camera tricks are employed is not what their buttocks looks like down the road. So
is it fixable?
A lot of times it's not. And that's the problem. You start marching down roads where it's difficult to correct some of the problems that can arise from these. So I strongly encourage patients to consider other modalities. I think that fat grafting with a modest amount to areas that are really deficient, right? That kind of the hip dip and some of those areas that people have. It's a great place to put some fat in, but just a global, I want a large rear end. It's just fraught with disaster. And I think as time goes on, we're going to see that there's more and more problems with it. Another question about, let me get this one to you. It's an easy one.
The answer is yes.
We both feel the same way about this. What's the best way to deal with cellulite?
Go to a psychiatrist. I don't know.
Yeah.
We don't know how to fix it. We've bought machines that we're told to fix it.
Yeah. Injections,
everything. And there just still isn't fixable at this point. So
yeah. I don't think any of the technologies that have come out have been long lasting. Again, we've seen great results in patients for a few months. And I think we have both felt that it's the inflammation after the procedure that has maybe caused that to happen. But unfortunately, we're just not seeing any long-term, and we really have. We've been through all sorts of different machines to try and cut the bands that are causing problems. We've tried to tighten the skin and all of those things. There's no silver bullet for this. And I always feel like people are kind of chasing their tails. There's some areas of the body that do better with some of these procedures, but none that we were so excited about or happy with the results that we didn't sell our machine, and that we didn't invest in the product that you can inject. So unfortunately, that is something that everyone kind of faces and has to deal with. And there's no great way to handle it. And
I'm teasing about the psychiatrist. It is the problem when people don't like it. We're not there yet. We don't.
The technology is just not there. Is a lower facelift beneficial for jowls, chin, and neck skin?
Yes. In general, it would be the right thing. And for patients that's the only problem, that's a good solution. Sometimes the directional pull for a neck lift is straight back. The directional pull for a facelift, which gets the neck and the face, is up on an angle. And I think generally that up on an angle is the best line of pull. But if your face is fine, to do a facelift to get 20% improvement on the jowl may not be warranted.
Yeah.
And so if just the neck's an issue, do the neck lift. If the neck and face is an issue, do the facelift. And we'll make it simple.
Yeah. And so not as a substitute for a neck lift or skin tightening procedures, but I do think that this is a good segue to talk about a new product that is being released to a small handful of practices, and we're one of them, right? We're one of 3 in kind of the Charlotte market that is getting access to a new hyaluronic acid, the Volux. All right. And so if I look like I don't know how to pronounce it very well, it's because I don't. And if it looks like it's brand new, it will be coming in this week or next week. And the only reason that this practice gets to do it is because they're putting it in the hands of the injectors that they feel will be the most responsible and have the most credentials to do it, right? I mean, we have a nurse injector here who, Linda Cochran-Owens, who is an injector for the company that makes these hyaluronic acids and Botox. And so
instructor.
Yeah, she's an instructor. She literally goes to other places and teaches doctors, plastic surgeons, dermatologists, other nurses how to inject these products.
And then, of course, Kristen and Terry, who are working right with her, get all her knowledge and soak it up like a sponge. And they're amazing. Awesome as well.
Right. And I'm sure, you can only have so many injectors per region. So
they're a great team.
I'm sure at some point there'll be those instructors as well. But, this is the first FDA approved hyaluronic acid for the jawline, right? And so everybody talks about getting a chiseled jaw. Sometimes people look at jowling and look at this big bulge here, but they can look at it artistically different. And they can look at it as if you see a bulge there, but you have a weak chin, you can build up around the bulge to still get that straight jawline. A lot of people have, deficient kind of angle of the jaw, angle of the mandible there, and it's a great place. We've tried other fillers before, Sculptra's been used, all sorts of different things, but this particular hyaluronic acid is the right consistency to be applied to the area of the jaw and feel more firm and tight and help with the jawline and subsequent, neckline as well, chins, that kind of area.
I'm going to pull a Ronald Reagan.
Okay.
And I'm going to say Allergan is an awesome company.
Okay.
And they make great products, and I trust them. But I'm going to verify.
That's right. I totally agree.
So
we will know, I think it goes out, I'm being told it goes out to the masses in January, mid-January. So we are getting it 2 months ahead of time. And our nurse injectors have already been trained on it. I'll say if it seems like he and I don't know as much about it as our nurse injectors, it's because this practice, I believe, is unique because we don't do injections. Dr. Graper and I leave that to the experts in our office. And so I couldn't credential them more. They're absolutely fantastic. There's a reason why people in the industry come to this office.
Well, they do it every day, all day, and we do it never.
Right. And so what I kind of, what I say is, I love good food, right? Like I love restaurants. One of my favorite restaurants is Stagioni. It's right in my neighborhood. I love it. But when I go to Stagioni, there are the chefs in the back making unbelievable food. And then there's the awesome bartender mixologist. And I don't want the mixologist going back there and making my food. And I don't want the chef going to the bar and making me my old fashioned or a martini or something like that. So, we want to put you in the provider's hands that's best at what they do. And for us, it's our 3 injectors. So they will know more about Volux. It's a pretty good name. I do like that name. And they'll, it should be available next week. So if you have that kind of weak jaw, weak chin, and you're looking to have some non-surgical, and they used to want to break your jaw and set it forward and do all these things, or chin implants.
Do you think it can be used as a chin implant?
I do. Yeah.
Ooh, that'd be big.
Yeah. I think it would be great to be used for that and non-surgical approach, which would be great. Well, we hear this a lot. I have a turkey neck and I really need to get rid of it.
Facelifts, neck lifts are designed exactly to do that.
Right.
And that incisions are well hidden around the ear and in the hairline. And, you'll look good at a week or sooner. And it's just not a big deal.
Right.
And it works fine.
So talk to me, you've taught me so much about facial plastic surgery and cosmetic surgery just in general, but specifically for the face, when people talk about a turkey neck, like talk about the components. You're constantly kind of talking, muscle, fat, skin, and how you kind of have to address all those things to help a patient. Everybody wants that 90-degree neck, like, my assistant Lindsay has. Oh yeah, I know, but I just show them Lindsay because she's got like this perfect 90-degree long neck and they all want it. So how do you address those different components?
Well, like you do with a tummy tucks, it's skin, muscle, and fat, and you analyze the individual patient and see what component of that do they need addressed. Maybe it's 2 of the 3, maybe it's all 3. And through an incision under the chin, you remove fat if you need to. You tighten the muscle and create a trampoline effect. And then through the incisions back here, you find that muscle, which is your foundation, like you talked about for the rectus abdominis muscle. You snug that up to accentuate the jawline. You snug it up in the face to flatten the fold out. It's called the nasolabial fold, and kind of accentuate the high cheekbones. You can use the suturing technique to create a dog ear over the high cheekbone, and that soft tissue accentuates the bone, and that looks really pretty. And then tailor the skin. So you're affecting the skin, the fat, and the muscle. And, the facelifts that we're doing now are the state of the art. Now, maybe we'll do them different in 5 years, but right now, and we're using this fibrin glue.
That's neat.
Allowed us to eliminate drains, and that really has greatly decreased the bruising and swelling. So literally look great, not great, but
operated
very
on
good
bit,
at a week. And whereas we used to have people that looked like they were in a prize fight at a week. And we still take pictures
and lost.
At 6 weeks.
And lost.
Prize
fight and lost.
But it's just not a big deal. And people always worry about, I don't want to look weird or different like the Hollywood people do.
Right.
And we fight that a lot.
Right.
That just isn't an issue for us. And they want to look natural and they want to look like themselves, but better and more youthful or thinner. And all those things can be done. Having said that, you can only be as good as you can be. Everybody can't have Beyonce's neckline, which is perfect, or Lindsay's neckline, which is fantastic. But you're going to be the best that you can be, and that's really all you can ask.
That's right. That's right. Another question about what do you recommend to reduce dry skin on the face as we age, and minor wrinkles, especially forehead and between the brows wrinkles?
They are estheticians. They are experts. Again, delegation of skills.
Right.
But I would call a guy and let them put you on a program, and they can probably put you on a daily routine that, 1 or 2 products in the morning, and at night, maybe less, and start there.
So we have 4 full-time estheticians that they would probably hate for me to quote that, but probably like a century of
They've been doing it a long time.
They've been doing it a long time. They're as knowledgeable scientifically about the skin as you can possibly. So, there are different reasons to have dry skin, right? And so there will be different remedies and prescriptions for each patient. And so any one of our estheticians is phenomenally capable of helping you with any of your skincare needs. Now, the wrinkles thing between the eyebrows, which I'm assuming you're talking about the glabella region here, and then forehead, there's a couple ways to deal with that. One is to skincare can help with that, but also, we have muscles in those locations that, just like creasing a page, taking out a sheet of notebook paper and continuing to fold it over and over again, that crease gets thicker and thicker. So fine lines become thicker lines. The more we do it, the more we age. So not only improving the quality of your skin, but Botox is like the answer of all forehead and glabellar wrinkles, right? Mm-hmm. And this is how they actually inject this Botox product into the muscles, which prevents those muscles from being able to activate and pull the skin and crease the skin. So it's like if my hands are keep folding this piece of paper, well, then the Botox will just stop my hands from creasing it.
Right. Just like your skin your muscles fold the
That's
skin
exactly right.
the same way every time. And for Garrett's analogy is an excellent one. The piece of paper folded over at the exact same time makes a crease.
Yep.
And the Botox stopped that. Now, I can't believe there's anybody who still is worried about the safety of Botox after literally 20 years now.
Right. And realizing that cosmetic Botox is a small fraction of the use of Botox products. I think it's like 95% of Botox is used in other medical, like other issues, esophageal sphincter issues and things like that. So 5% of Botox is used in cosmesis. So it's been studied ad nauseum.
And like the amount we use or our injectors use is similar to taking 2 aspirin.
Right.
That's pretty safe. If you take 200 aspirin, you're going to die.
Mm-hmm.
If you take 200 times what we inject, you're not going to do well.
Yeah, that's not going to be good.
You're not going to do 200.
Right.
So, it's extremely safe.
Yep. One more question, and then we're going to get to some before and afters. We'll get to the first set of before and afters and kind of tell you what's going on with the surgeries. Question about breast implant material that is being used. So breast implants, for all intents and purposes, not going back to like the 1970s in Houston and all that kind of stuff, have been filled, right? The silicone gel shell, which is the balloon, has been filled with 2 different materials. One is normal saline, salt water, which is still used today, certainly much less than it was 20 years ago when it was the only thing that was on the market in the United States. And then where the real technology has been driven and changed is with the silicone gel inside the silicone shell. And that silicone gel has gone from this kind of consistency of honey molasses to where if the bag broke, it was just kind of
gooey.
Yeah, just a mess. And so when patients come in with 40-year-old gel implants and they're ruptured, we know that's what we're going to find. Now we try to take out the shell, the scar tissue around it so that none of that even opens up into the body. But we do everything we can to ensure that no silicone is left behind, right? And now it's moved into a gel that's cohesively bound. So if you take a samurai sword to these new gummy bear implants, I hate that name because everybody thinks of the stale gummy bears that you find like between the seat cushions after your kids left them there from 3 Octobers ago.
You almost can't eat those.
You can't eat them. I tried, but you can't. It's a soft gel that doesn't ooze, right? So they have this technology now to where, wow, it's a formed implant shape that doesn't change with postural change, but yet it's so soft and amazing that you don't sacrifice any of that feel. So, I mean, the new devices are phenomenal. I mean, when people come in and say, do I need to change out my implants? I'm like, well, I mean, if you're not having any problems, you don't need to. But if you're not having any problems with your, 20-year-old Mercedes, do you need to get the new Mercedes? Do you need to get the electric Mercedes?
Rocket.
And I say yes, because I love that car and the new implants by chance. All right, so let's talk about the first set of before and afters. I'll talk about the top, and then Dr. Graper will talk about the bottom. So the first at the top is a mom. That's why it says mommy makeover, who came in, breasts were deflated, meaning she just felt like she had no volume anymore. Likely happens after breastfeeding, commonly happens after breastfeeding, and then had excess skin and a little bit more fluffiness to her midsection than she wanted. So for this patient, her nipples were in a beautiful position, so they did not need to be lifted. So we went with an implant that's above the muscle, that's placed through incisions in her breast fold that are less than 2 inches. You'll never see that incision. It hides perfectly in your inframammary fold crease. It does take a little bit of time for your breast tissue to stretch out and for you not to look so operated on. We say trust the process. And then from a tummy standpoint, she did the abdominoplasty, right? Where we bring her muscles together and then we redrape skin and subcutaneous fat. We bring her belly button back through her own, belly button doesn't come off with a tummy tuck. It stays on your abdominal wall and then comes through a new area. So her incision is within her panty bikini line. And I think this really just completely changed her shape and her figure, and I think her confidence. I think one of my favorite quotes from a trip my family took this summer, we went to the Christian Dior Museum in Paris, and he said, I got to the point where women finally started realizing that I didn't want to just make them prettier, I wanted to make them happier. And we find that a lot with our patients, right? Obviously, they're coming to us because they have concerns over an issue that may be holding them back in their kind of quest for true happiness. So it's nice to see that that patients get that kind of lift from
Confidence is
surgery.
everything.
Yeah, it's amazing. So what about the second case there?
Well, that's a facelift, a fairly typical patient who's kind enough to let us use her pictures as a demonstration. That picture is taken at 6 weeks. And what I would point out is just a couple things: that she looks like the same patient. She looks better. She looks refreshed, and the incisions are unimportant.
Okay.
And, really, other than that, what are you looking for in a facelift? You want to be better. You want to be you, and you don't want to have people saying, well, wow, what did you do? And there's a little different strategy. Some people like to do it so nobody ever notices that they get older,
Right.
And they then don't have such a big change or delta.
Right.
Other people say, well, I want to wait till I can really see a big difference in it. But that entails then they have to look kind of bad for a while.
Right.
And what you don't want to have happen is your grandchild say, Gigi, who's that?
That's right.
Everybody has a different style and when they do it and when they want to do it. And the important thing is it's safe, it's reliably and predictably better, and reasonable thing to do.
Right. Another question about time frame of starting to work out after just kind of surgery in general. I mean, this says tummy tuck, but so I typically tell patients for the first 2 weeks after any surgery that I do, I want you to chill out. And by that, I mean, I don't want you to do anything that makes you sweat. I don't want you to do anything that makes your heart rate or your blood pressure go up. And so you're not even getting your walking shoes on and like going in the neighborhood at that point. You can walk and go get your mail. You can walk around the house. You can run errands. I'm fine with that. You can drive a car if you're not on pain meds with most of the surgeries, but you're not in a gym working out or doing anything like that for the first 2 weeks. At 2 weeks, especially with a tummy tuck, because a tummy tuck insinuates that like we've brought your muscles back together. So if you stress the core at 2 weeks when literally the suture is what is holding those muscles together, you can easily pop them just by bearing down really hard or doing a complex core exercise. So at 2 weeks, you can start light cardio, put your running shoes on, get in the neighborhood, start walking around. Still don't want twisting motions or anything like that after a tummy tuck. But at 6 weeks, I tell you, you've got no real restrictions. Now, that doesn't mean that you don't need to listen to your body, because you do. If you're a big tennis player and you haven't played tennis for 6 weeks and you had a tummy tuck or you had breast surgery, I'm not going to go directly out and start hitting overhead slams, but I will work your way up to that. So at 6 weeks, you really can go do whatever you want. So that means at 2 weeks, when we let you start kind of light cardio workout, and 6 weeks, you can do whatever the heck you want. I mean, within reason. Then you pace yourself, right? That doesn't mean at 2 weeks and 2 days, you're doing everything.
Core yoga.
That's exactly right. So, at 4 weeks, I typically say if you want to start doing an elliptical or ride a bike, that doesn't mean you want to like finish first in some Peloton climb or anything like that, but you can start getting that back in, right? So from a weight standpoint, everybody comes back, after major surgery and they're like, I got on the scale and I weigh 8 pounds more than I did the morning of surgery. It's because they're swollen, right? They're taking this fluid on and the body's putting it all over. And so it's water weight. And then they want to take LASIK pills. And you're like, just let nature take its course, get through the healing process, and your body will take care of itself. But nobody needs to be stepping on scales, immediately after surgery.
It's a big process.
It is.
It's like redoing your kitchen.
Yep.
It's a painful redo of the kitchen, but when it's done,
right,
you're really pleased you did it, and it's good for a long time.
Absolutely. All right, so let's get to the second set of before and afters. And this kind of, I guess you can maybe differentiate between the facelift and the neck lift for patients, and then talk to them, since I don't do the Croton oil peel.
You got to get you doing it.
I know. Talk to the patients about it.
If you weren't so busy doing all the breast and body, you would have time.
Probably so, if I wasn't so scared at how they look for the first 5 days afterwards.
It's a great time thing to do around Halloween.
That's very true.
So the first one's a neck lift, and so that direction of pull is straight back, and the jowl is improved, the neck is improved, but the cheeks are not improved. The incision is very similar. The recovery is very similar. We use that same fibrin glue, no drains. It's just very straightforward stuff. And you can see she looks better in a subtle way. She wasn't real bad to start with, but she definitely looks better and looks like herself.
Right.
The second one is a lady that did a Croton oil peel, and I don't know the resolution of what you can see at home, but there are lines around her eyes, there are lines around her mouth, there are lines on her cheek, and they are all gone. And we do that by applying a combination of chemicals that include Croton oil. And it's called a Croton oil peel, but it also has phenol in it. And it literally removes the outside layers of skin, the epidermis that you can see and touch. And what makes the epidermis is the dermis. So the peel goes down to below the level of that wrinkle, the same wrinkle that's made by creasing the skin the same way every time when the muscles contract. And it is raw. And, it has to be raw to have that kind of power.
Oh, yeah. It's powerful.
The first person who's ever done one of these was probably very frightened, the doctor and the patient.
Mm-hmm.
But it works.
Yeah, it does.
I would have to say that
it's probably the most powerful. It's got to be.
It is very
powerful.
Resurfacing
agent that's out there.
Right. And so it can get rid of those lines and it really needs to be raw. And when I say raw, like a burn for 7 days, even 10 days for the deeper ones. And we would rather do it twice safely than do it once and replace a wrinkle with a burn scar.
Right.
Because you can do that.
Absolutely.
So when in doubt, we're cautious, and patients come in and go, this is awesome, but I still got this wrinkle here. Fine. We'll redo it at no cost because we want it to be safe.
Yep.
And you can do it with a laser. But the laser has a lot more cost than the chemical agents, and we know how to do the chemical agents. You're going to know how to do the chemical agents.
One day I will
because
gather the strength and courage.
The wrinkles are the quality part of the skin and the facial rejuvenation. The extra skin, the extra fat, the loose muscles are the quantity part of the facial rejuvenation, and you need quantity and quality improvement. The analogy Garrett heard me use a bunch of times is the qualities, the dry cleaner, when your slacks have mustard stains on them, but if they're still too big because you lost 20 pounds, you take them to the tailor.
Right.
The tailor and the dry cleaner are different things.
Right. They work together to get the best result.
Right.
Right.
Just like your bartender and your chef.
That's exactly right.
So they're complementary.
Yeah. 2 more questions. So someone had a tummy tuck with liposuction years ago. Can you have liposuction again? Of course. I mean, the question is the area that was liposuction the area of concern now? I mean, I would tell you that I'd be happy that you still have fat. I think over liposuctioning somebody is where we really get into trouble, right? The idea along the lines of the butt enhancements with fat grafting, right? That someone would go get over exuberant and overzealous liposuction in a grid-like pattern to try and etch themselves 6-pack ab muscles is a horrendous idea. It may look good for a little while, it will not look good in the long run.
You mean that 60-year-old waffle iron?
That's exactly right. That's exactly right. And so as you gain weight, change weight, I mean, you're basically asking your skin to scar down to muscle and then leave fat in like little block-like shapes to give the appearance that you are healthy enough and fit enough to have six-pack muscles. Big mistake, right? And so unfixable. And so liposuction can be done if you can grab fat, right? Oftentimes, if people gain weight around an area that has been liposuctioned because of weight gain, those areas may need to be blended, those areas may need to be liposuction now. When someone comes in and says, I want liposuction everywhere, my answer to them is that's weight loss, right? And so stubborn areas are great to get liposuctioned. Whole body liposuction is not the answer. It's not the safest way to do it. It's not the smartest way to do it. Another thing that I continue to hear is I hear if you get liposuction somewhere, you get fat in other places. So fat cells are storage centers, and they are distributed on your body however they're distributed. Some people hold it in their hips. Some people hold it in their midsection. Some people hold it in their chest. Some people hold it in their neck. Some people hold it in their earlobes. Wherever you hold it, that's how it's been distributed genetically to you. And so if you remove those areas of storage and then you gain weight, the areas that weren't removed are preferentially going to store more fat and get larger. But if you don't gain weight after liposuction, you won't get fat in other areas, right? So that's why it's important that you decide the timing of your surgery is right. You don't want to starve yourself for surgery, and you don't want to just, whenever I see a patient that says, hey, this is what I weigh, my surgery's in 3 months, I'm going to weigh 10 pounds less. That's my goal weight. I'm like, awesome. We bump knuckles, can't wait for their surgery. And they show up that morning and they've gained 20 pounds. And they're like, well, I just figured you were going to suck it all out anyways. Also not smart. Like, go into surgery at a comfortable and like maintainable, stable weight situation and fitness situation.
Good candidates get what kind of results?
Great results. Good results.
Bad candidates get
bad results. Yeah.
So why would you be a bad candidate?
Right.
Because the cost is the same. We're going to do the best we can do, but if you're not a good candidate, there's no way you can get a good result.
Right. So after a 2013 facelift, what's a reasonable time frame for a touch-up? Like, meaning maybe another one.
Everybody's genetics are different, so they will age differently. And some people with a 9-year-old facelift will still look great, and others, because of their genetics, their sun exposure, their diet, believe it or not, how much protein they get, their smoking history, may be ready right now. And you'd like to think a facelift will last 10 or 15 years. And, facelifts will look better forever.
Right.
In that, when you're 85 years old, you'll always look better than you would have looked, but you could still use another facelift.
Sure.
So, look at your parents. If they look good, do what they did in terms of their diet, their sun exposure, their smoking, all that stuff. You can't fight genetics.
Well, and I tell people all the time, I say, there's a maintenance to everything that we do. You're going to age, right? If we set the clock back and you start aging again, fine. But there's a maintenance. So when you had your facelift, were you seeing estheticians like the ones we have here? Were you getting little RF microneedling, procedures and things like that to prolong your great results? So I'd say there's no right answer to that. Like, if you're ready, then you're ready. Is it safe to have a touch up or a redo 9 years later?
Absolutely. And, it's safe to have facelifts, neck lifts, eyelids in your 70s. We've done a few in our 80s, not very many. I would say that results that you operate on patients in their 70s don't last as long as results in their 60s or their 50s because the skin's just not as good.
Right.
Doesn't mean you don't do it. It's just tempering your expectations.
Okay. Quick answer to this question, because if the nurses heard me right now, they would laugh, because they've heard me say this like 8 billion times, because I do toot my own horn on this. It is under the muscle or over the muscle implants will be easier to detect breast cancer tumors. I literally wrote the book chapter on this. When I was a plastic surgery resident, I was asked to write the chapter for this big time surgical oncologist from Alabama, Birmingham. Kirby Bland had a book called The Breast. And so the title of my chapter was literally Cancer Detection in the Previously Augmented Patient. And what we found is there's absolutely zero statistical difference in the detection of tumors in patients with no implant, with implants under the muscle, or with implants above the muscle. There's no statistical
Current technology.
significance.
Might have been a different answer before.
Correct.
And are you available to sign autographed copies of that book?
If you buy the copy on Amazon, I will sign it for you.
Excellent.
Yes.
And for patients as well.
They probably don't want it, but I will sign it for them too. Yes. All right. Do you encourage lymphatic massages after a tummy tuck or other major surgeries? Yes. I mean, we have several lymphatic massage people that we work with that I think are terrific. Lymphatic massage therapy is a wonderful adjunct to your recovery process. It allows this fluid to kind of find its new home. It teaches the body where this fluid needs to flow to get reabsorbed. I think it's a wonderful way to expedite your healing process and to improve your circulation, improve the flow of all of your lymphatic system. And I think it's just terrific. Yeah. Let's go to the third set of before and afters, and then I think we're almost done after these. So the third is a tummy tuck at the top. I would just tell you this patient had their muscles brought together. You can see that their incision is below their bikini line, and just how much of an improvement their overall shape has been. I would also tell you to look at their belly button. We do a very beautiful, natural looking belly button that is this little omega flap inset to where you have a hood and a ramp to your belly button and not the target balloon sign. So I think that belly button is as pretty as it can get. And then facelift, neck lift, you've kind of already gone over, right?
Yeah, I don't have a whole lot more to add to that.
Okay.
Again, natural, looks good. Incisions are hard to see. Safe.
Right. So one more thing is that National Botox Day is November 16th. So make sure you follow us on our Instagram, Facebook, all our different social media accounts, and it'll show you exactly what to do to get savings on Botox. We have giveaways tonight that have been in the messages. If you've been looking at kind of all the different messages, you can also look on our social media accounts for that. And then you take us to the finale.
Debbie, how much time we got? Okay, 2 minutes. So if you've been listening to this and you're thinking, is this good for me? How do I know this is good for me? Yeah. Well, I think there's a couple of criteria, and Garrett and I share this. You know, you have to have a real problem. That real problem has to bother you.
Right.
There has to be
bother you.
Yeah.
Not your spouse, not your best friend, not your mom, not your dad.
And your twin sister could have the exact same thing and it doesn't bother her. She shouldn't do anything.
That's right.
There has to be a known, reliable, predictable solution for your problem. It has to be a safe solution. Correct. You have to be in good physical shape so it is a safe operation for you. Right. It has to be affordable, so you're not, mortgaging the ranch.
Yeah, don't cash in your 401k to get cosmetic surgery.
And so if all of those are true, it's a very reasonable thing to do. If one of those things isn't true, you got to think about it.
Right.
If two of them aren't true, I probably wouldn't do it.
Yeah.
What are your thoughts?
No, I think that's great. I think that I tell patients all the time. I say, I'm not the body police. I'm not the breast police. I may think that you look great. But if you have something that you identify and there is a safe, reliable solution to it, I will offer you that solution. And then ultimately, the patient is who guides this. But I also tell patients, you're interviewing me and we're interviewing them. We got to make sure that it's a good fit to be part of your team. Yep.
Yeah.
Yep.
Another way to think about it is, does this bother me enough? If you think about it once a year,
Right.
forget it. If you
Right.
think about it twice a day,
Right.
you better come talk to us.
That's exactly.
Once a week, come talk to us.
Yeah.
Once a month, getting a little less clear.
Right.
Once a quarter, probably not.
Yeah.
And so just common sense stuff will guide you. And when in doubt, come talk to us and
Right.
we'll help you.
Or if it's something that's not surgical, make sure that you talk to one of our esthetician team, nurse injectors, or cool sculpting nurse. Our PRP gal, Stacy, is phenomenal.
She's great.
We didn't even talk about that, which we could have spent the entire hour on it. But Stacy's here on Tuesdays and Thursdays and is a PRP hair growth wizard. She's phenomenal. She also helps with PRP injections to the face, which have had great success in our practice. And she's just been awesome to have here. So if you want to see any of our staff, any of our providers here, come talk to us, come talk to them, call our office 704-375-7111 and schedule an appointment. The gals at the front will listen to what you are looking for and they will put you in the best hands to get you what you need.
Don't forget the Ginzu knives.
That's exactly right. Don't forget those.
Call now and
That's
you
right.
get the Ginzu
That's
knives.
exactly right.
And
that's right. That's right.
Well, thank y'all for watching tonight. We've had fun doing it.
Yeah.
I hope you've learned something.
It's great. Yeah. See y'all soon.